Abdomen is just slightly left of midline. So we're going to listen for the bell now because we're listening for bruits. So we listen here. Now when I come down, remember that your umbilicus is usually L1, L2. So then your kidneys are going to be somewhere T10, T12, T11, L1, depending on which side you're talking about. The right, obviously going to be a little bit less. So right kidney would be somewhere here because remember the aorta is here and we branch off and that renal artery is not real big, okay? And then left would probably be somewhere right around in there, okay? Then iliacs, I used the base of the umbilicus to show where that's at. I didn't know how to tickle bug. So show where that's at. So then we kind of go where that bifurcates and right here. Now for student modesty, we just want to listen and show where we would be. You don't have to go whopping down your stethoscope and like, I gotta hear this. Just put it over where you would listen for the femoral arteries without touching the patient and breaking their modesty, okay? All right, so
Percussion.
next we'll move on to percussion. This is the art, guys. You're going to have to practice on, okay? And so you just have to work at it. So she's relatively thin, so it should go pretty good. So start in your right upper quadrant if you wanted to, or whatever quadrant you want. Pre-tympanic. Pre-tympanic. Come down to the lower quadrant. Tympanic. Lower quadrant. Tympanic. So she's got 4 quadrants that are tympanic or tympanitic, if you want to use that word. And so that's good. Okay. Next,
Liver.
percussing the liver. So this is a little tricky, especially on females. And so what we want to do is I typically start at the lowest point on a female especially. So I know the liver is probably not down here in the abdomen. So what kind of sound should I have? Tympanic. So I start down here to get my baseline. So remember, I want to be a mid-clavicular line, which kind of almost passes over where the middle of the breast would be. So everybody hear a change? Definite change there. Try to get her close. So now I'm in an awkward position because I need to kind of find the upper region, but she's a female. So what I ask her to do is what I asked her to do earlier. I want you to really pull back as far as you can, and I'll try to assess this as far as I can, protecting her modesty. Probably lung, okay? Everybody hear that? Kind of deadened. I'd make a mark right there, and then meet the spot I had earlier. So somewhere right around in here is where her liver lives. Right, in mid-clavicular line, which is about 2.5 inches, so that's about right. So that's how you would do that. Percuss spleen.